The problem here is about private practice. We all sometimes, go into the zone of comfort rather than of hassle of private practice. It is a zone of comfort of private practice because you're so happy with your busy OPD, with your ward, with your OT. You also have to market, you have to keep yourself updated with the technopods around there. You have to be branding yourself, you have to attend conferences, you have to be social, and family life is screwing you down, your personal time you're not finding. And of course in city of Bombay, you also have to have time for travel. And in all this, the only thing that comes to your mind is time किधर है boss publication के लिए. Publish कैसे करेंगे, लिखेंगे कैसे, तेरे को टाइम कैसे मिलता है. So more often than not, whenever my paper comes up, one of my colleague or my senior will come, तेरे को काम धाम नहीं है क्या, क्या तू पेपर पब्लिश करता रहता है, तेरे को टाइम किधर से मिलता है. And the only thing I tell them that मेरे पास 24 घंटा है दिन का. I don't know where you lose your time, and it is all about time management. And why do I say so is because based on my experiences, as my work from 2015 has increased from 250 cases a year to today I do more than 400 cases a year, my publications have only doubled up. And this is the fact that the more cases you do, the more convinced you become about your philosophy, and the more publications you can come up with the more time being consumed into your practice, the more time you can devote to your publications. And that's just a history sheet of what we have in our experience. And it is not true that we are publishing in lousy journals. We have had our share of publications in the most reputed journals in spine, and the simplest of the journals also, including the IJO, the ISJ, the Indian Spine, Indian Journal of Orthopaedics, to Spine, The Spine, European Spine, and many more. And it is not about the big topics that we have published only on some niche topics of minimal invasive spine surgery or scoliosis. Yes, of course, we have our share into craniovertebral junction, C1, C2, and cervical myelopathies. But we also have share on some simplest studies, like we had a paper recently coming about outcome of cervical laminectomy in multi-level cervical myelopathies. It's as simple as that, only presenting out 25 case series in OPLL, and it is published. Also, learning curves. What problems I faced in my first 3 years versus how good I am at the same surgery now, and all those problems highlighted and how we overcome that. We have 11 papers on learning curves on simplest surgery that we perform on day-to-day basis, including microdiscectomies, MEDs, tuberculosis spine, C1, C2s, and they just get accepted. The reviewers just embrace your learning curves because you highlight your problems as a beginner when you start doing these surgeries. And we have had publications in all these things. And where is the time? Like I said, I have those 24 hours, which you have it. And if you feel that I only devote time to publications, no. Ask my gang of goons. Sandeep is here. We trek, we travel, we run, we party, we work. We do everything that you all have been doing apart from our family life. And of course, I attend as many conferences as I can on my toes. And I continue to work. I continue to work not in 1, 2, but 3 centers in city of Bombay and 3 centers outside Bombay. And I still have only 24 hours in a day. And so in private practice, if I had to say that 60% of your time is awake time, which involves OPDs, wards, OT, pre-op, post-op, marketing, branding, conferences, travel. This is that 66% of your time which you can utilize in a very simple manner if you get into the zone of conviction that you can publish, like I did in 2014 onwards. And for publication, there are certain prerequisites, and out of the prerequisites, the first 3 are that I want to do it, I can do it, and I will do it. The moment you have this कि साहब मेरे को तो करना है, आज नहीं हुआ तो 5 साल में करना है, 5 साल में नहीं हुआ तो 10 साल में करना है, but करना है साहब. I have to bring out some papers of what I am doing, and believe me, in no matter of time you will have your paper in there. And I'm telling you that you either find a way or you'll have to walk the way the life comes up to you with. So the prerequisites that I have been following all these years, I would be more than happy to share some with you. It may sound like a philosophical talk, but these are the fact matters, that the first thing that you require is the will and wish to do. Just the first thing is start believing in yourself that you can publish. It is not a big thing. Believe me, a lousy person like me can publish. Anybody here who is an academician can easily publish, and we have guys sitting outside who do nothing, but they still publish. We all can surely publish from whatever work we do. The only thing we need is an idea. कि दिमाग चलते रहना चाहिए कि क्या चल रहा है मेरी लाइफ में, what is it that I am seeing, and it doesn't has to be a brilliant idea, a simple idea. For example, how many of us have actually followed our patients upon the incidence of osteoarthritis in squatting women population versus non-squatting women population in India? It's such a wonderful, beautiful paper, and it is not there. Before coming here, I was searching on internet that there is incidence of arthritis in squatting Indian women versus non-squatting Indian women. It's a brilliant paper to come up with if someone has only knee pain patients with clinical radiological features of OA, but nobody has studied so far. So think about the idea and continue thinking it and pen them down. Second is effort. You got to just put in some effort into it. Find a topic of research. So once you have the idea, start putting in effort. And it doesn't necessarily has to be something very niche, that I do a posterior cruciate retaining knee joint replacement or a complex STOs or I use complex implants. No. You have to find something that you do or see in everyday routine. Perseverance, continue working on both, continue finding new and new ideas, pen them down and continue putting your efforts into it, and allocate some time. It can be as small as 1 hour a week, but allocate some time ki this part of the day, this day of the week, I will surely think and work on my research, and you will see that your internal audit, where do I stand today, will help you allocating more time and you will start enjoying doing research. And of course, find a tribe for yourselves. You cannot do research on yourself. Probably find a colleague who can help you with data management, your fellows, your residents, or even nursing home staff. You know, your boys, your ward boys can help you in data keeping and things like that. You just have to delegate work to them, and you will see in no matter of time, your paper will start taking shape in there. And when it comes to will and wish, make a think list. And nowadays on phone, you can just write down the idea that comes to your mind. And it is not important that the idea that you think today will publish in 1 year. It may come up in 5 years. But if it comes to your idea in idea tank, you'll start working towards it. So start working towards it. Find a research topic, and it can be as simple. I'll just take 1 quick minute. So think about the idea that is so near to you, whatever. It can be as simple as finding like squatting and non-squatting population, or it can be as simple as the incidence of back pain in patients with facet tropism. We see thousands of MRIs every day. How many of us have actually drawn lines to see the facet angulation and considered whether back pain is significantly seen in facet arthritis versus facet tropism or not? So these are some topics that we see every single day, where these are some observational studies. It can be as simple as topics like shoulder arthritis in patients who are having overhead occupation versus who are having table occupation. So these are some small topics which you see day in and out, and these can easily become papers from our continent easily. And the second step is, once you have found an idea, start putting in effort and start reading about it. You don't want to do work on something and see at a later date, to publish ho chuka hai pehle, and like reviewers' comments come across making you feel lousy. And then continue repeating on this. Once you have put in this, define the objective. If you have defined the objective that I'm going to study this, your 90% work is done. Once you have defined the objective, your introduction before the objective is so easy to write. It is beyond the scope of this talk here, basically. The idea is perseverance, that continue working on it, continue thinking about the idea, define your objective, and then the study design is very simple. For example, in a knee patient, you get knee pain patients, get the squatters and non-squatters differently, check their x-rays and get a data study done, and the results can then be analyzed, and your statistician can really come up with a very simple thing. So the idea is that you have to continue thinking about ideas and start working towards them and find the simplest topic. Believe me, it is the simplest topic which brings in the best research rather than a very big idea with a lousy methodology. So concentrate on your methodology, find the simplest thing in your OPD practice and start working towards it and continue working towards it. It may happen that your paper may take shape after 2 years or 3 years, and the first paper will bring you so much more stimulation and motivation that you may want to surely work upon the other thing. And whatever kachra comes to your mind, the idea is write it down. It can be as simple as writing the basic introduction. आज introduction लिख के छोड़ देने का, 10 दिन के बाद review करने का. On the research day when you have allocated a specific time, go and read it and then rewrite it and then rewrite it and then rewrite it. Probably in a year's time, your one paper will come up yourself, and this internal audit will surely give you results out there. As I said, perseverance, internal audit, and priority time. Once a week is bare minimum that you should devote to get in and work on it. And again, as I said, whatever comes to your mind, please write it down. And the last but not the least, research is a teamwork. You cannot do it all independently. You have to delegate some part of your work, because there are thinkers who can generate idea. Like in my team, I am the thinker, but my fellows are the doers who do data collection. I have staff who do the doers, who will take pictures and keep it in the storage box. And then there are internal audit. My old fellows, my colleagues, Sandeep, Arjun and Kshitiz, they have been auditing my own papers before I send to external reviewers. Our internal review committees will come up and tell me that this is wrong in your paper and you may probably want to audit this before you send for submission. And once you are done all this, the only thing that remains is submission. Others' instructions are always there. You can surely work on that. And remember, before you start writing any of this, remember whatever you are working upon, you must take advice of a statistician to determine the power of study. At the end of 1 year, you don't want to come up with an answer by the reviewers that your power of study is less. And that is why, before the idea comes into your mind, talk to your statistician, talk to your friends, talk to your colleagues, that what do you think is the appropriate number of patients that I should enroll into this. And the most important thing as per law is any study and every study requires one thing, and that is informed consent. And that is why every patient you enroll in, even if that patient is not included in your study, but tomorrow he can easily come back to you saying that you have not taken my consent. And that is why every patient you consider that this is going to be a part of my study, even if it's a minute part, including the staff, the fellows, you have to have a consent from them that this is your primary study and this study is done with an informed consent by them. And there is a specific law also against this. If you are not taking it, you are under the preview of law. So to conclude, will and wish, Believe in yourself, choose the simplest topic that comes to your clinic and start working on it, and put in some effort, put in some priority time into it, continue working towards it. It's not necessary to publish in a deadline. There is no race of publication happening there. And even if you publish, nobody's going to clap for you. It is you yourself who will feel happy. And it is all about teamwork. Involve your friends and make your tribe for this. Thank you so much.